Well, welcome everyone, and thank you for being here today. We're here to share some news about the Deflection program that began serving people in our community in September of 2024. We're going to hear from our county leaders and key partners who've been working to connect people in the community to substance use disorder treatment and other supportive services. You're going to hear today from Multnomah County Chair Jessica Vega-Peterson, Director Heather Marisol, who is from the county's Behavioral Health Division, Portland Police Bureau Commander Brian Hughes, Tony Vesna, who is the Executive Director of 4D Recovery, and Bernard J.B. Foster, who is the Chief Executive Officer of Turk House, who is our contractor at the Deflection Center. And with that, I would invite Chair Jessica Vega-Peterson to come up.
Thank you, Julie. Good afternoon, everyone. I'm Multnomah County Chair Jessica Vega-Peterson. I appreciate your time today to cover a critical milestone in our work to provide greater behavioral health support and pathways to treatment and recovery in this community. Heather Marisol is going to be talking more about the data and information contained in the report. I'm here today to stand with our law enforcement and our behavioral health leaders and partners to talk about the first quarter of Multnomah County's Deflection program. So 1 year ago at this time, the Oregon legislature hadn't even passed House Bill 4002 to change our drug laws. 6 months ago, there were 0 deflection programs in the state of Oregon, and Multnomah County was on a very fast track to open mobile deflection on September 1st, and a facility where law enforcement would take those being deflected by mid-October. 4 months ago, we were just opening our deflection center and beginning to welcome clients. Today, we offer our community the first comprehensive data that includes program performance metrics for the first time, including completion and demographic data. This follows several smaller data releases and updates since our deflection program began. Data is a critical component to the work that we're doing, and one of the reasons that rapid early investment in our county's deflection program was so that we could begin collecting data to better understand who we are serving with deflection, what we know about them, and how we can improve the systems that we've set up. Because this first quarterly release is helping us to understand more clearly how this program is benefiting our community and what we should be considering as our next steps. We are among the first counties to release data from our program because transparency is so important and matters so much. We know being transparent and accountable makes a difference, and we're committed to doing both of these as we move forward. This work has taken a laser focus by the Multnomah County Health Department. It has taken leadership across a broad group of stakeholders, especially law enforcement partners from our sheriff to Portland and Gresham police bureaus, our district attorney, and behavioral health specialists from providers like MHAAO, Turk House, 4D, and I really want to thank Turk House for the work that they've done both here in the community and for the 50 years of work that they've led in Maryland on treatment and recovery and deflection services. We have been tirelessly working to get the program up and running because we knew that that was the start of something very important. Deflection serves as a cornerstone to our commitment to improving our behavioral health continuum of care. My focus now is on considering how we can expand services at the Coordinated Care Pathway Center to make our continuum stronger on behalf of the many people who find support there. People who will be giving a chance and a new beginning. People who will not go to jail, but instead will meet people who will walk alongside them on their journey to recovery. Expansion at the Pathway Center is already underway in 2 key areas. So first of all, later this spring, we are opening 13 sobering beds at the Pathway Center, and we will begin offering a place for people to go instead of the ER when they need to sober up and connect to services. Second, from discussions at the House Bill 4002 leadership table, the Multnomah County Health Department is developing next steps around adding additional pathways into these services through providers, outreach workers, and first responders who regularly work with and support people with substance use disorder or who would benefit from pathways to treatment and recovery. Since the beginning, this has been about helping people get access to treatment instead of funneling them through the legal system with little support for treating their substance use disorder. I'm grateful that the state of Oregon added deflection as an idea and the resources to support deflection specifically in this approach when they passed House Bill 4002. I'm proud of every county in Oregon who has been working to connect people in this new way to the services that they need. And I am extremely proud of Multnomah County, especially the many hardworking staff across our health department for taking up this call to action, building a safe and compassionate space for individuals, and making a difference in the life of every individual they serve. I'm also so grateful for all of the partners who have been doing this work since day one in planning and providing services and helping us make this program what it is and what it will be next. We are just getting started. I want to end with the story of one of the participants who found what they were looking for at the Coordinated Care Pathway Center. Many brave individuals have come through the center's door since October and have started to connect the dots in their lives in a new way because of that. A deflection participant presented to the center requesting support with re-enrolling in treatment services and connecting with support systems outside of Multnomah County. Pathway Center staff was able to connect this participant with their support system, arrange for transportation, and schedule an intake with a local treatment provider. The client has successfully enrolled in both mental health and SUD treatment services and is actively engaging in peer services as well. Learning from stories like these is important as we continue to improve how these resources make an impact and how we can connect even more people to stability, to treatment, and to recovery. Deflection would not be possible without a deep commitment by our law enforcement partners to deflect people into the system. It would not be possible without our providers who are doing the work every day on getting people connected to recovery and knowing that recovery is possible. I am so impressed by the way each of our partners have shown up at this table and are committed to that work. I am now glad to welcome our Behavioral Health Division Director, Heather Mirasol, to the podium to walk us through the information in this report. Thank you.
Green light. Awesome. Thanks, Diego. Thank you, Chair. Thank you all for. Yes, my name is Heather Mirasol. I'm the Division Director for Behavioral Health with Multnomah County's Health Department. I use she, her pronouns.
There we go.
Or we could just remove it. Can everybody hear you?
Yeah.
Okay.
Yeah. We'll just turn the microphone on. Sorry about that.
It's a good thought. So thank you for being here today. As I said, my name is Heather Mirasol. I use she, her pronouns, and I'm the Director of Behavioral Health with Multnomah County. We're pleased to share with you an update on how the deflection program is working at the Coordinated Care Pathway Center. We've learned a lot since launching this new program last September. And what's most important to understand is that this has added a new treatment opportunity for members of our community who are struggling with addiction that was not otherwise there previously. As Chair Vega-Peterson said, the program is working as intended. It's diverting people away from the legal system and into services that support them in beginning their recovery journey. This program is voluntary, and it is supporting individuals who are choosing treatment. We aren't just seeing one or two people take the first step. We've seen hundreds embrace the support offered at the Pathway Center. Through this deflection program, we have connected hundreds of community members to treatment and other supportive wraparound services. We must also remind the community that the journey to recovery is not a straight line. It often takes people multiple times to achieve long-term recovery, and every engagement, every encounter, every referral brings people one step closer to recovery. We know that arresting people does not treat addiction and mental health disorders. Deflection offers a more effective way to treat these conditions by providing a behavioral health pathway. We will continue to ask for patience as we work to collect, analyze, and share data about the program. Due to reporting timeframes, it takes up to 60 days after a person initiates deflection to determine the outcome of that deflection. Since the program opened, we have been sharing data on the number of people referred to deflection and the number of referrals being provided. But given the 60-day period from initiation to completion, we're sharing the first full set of completion data for the first time, which is for September 1 through November 30th of 2024. We will also be sharing referral data from September 1 through December 31 of 2024. Law enforcement made 221 referrals between September 1 and December 31. Of those referrals, there were 9 repeat referrals, which means 212 unique individuals were referred to deflection overall. Of the 212 individuals offered deflection, 141 of those referrals, or 67%, resulted in an initiated deflection. As mentioned, we now have 3 full months of completion data between September 1 and November 30th. In this window, nearly a quarter of deflections initiated were considered successful. 54% of the deflections initiated were considered not completed once we verified that clients did not access the referrals within a 30-day period. 31 deflections are still pending verification. As we have previously shared, people who initiate deflection are often referred to numerous services. However, the number one most common referral at 35% was for withdrawal management. And the number 2 most common referral at 31% was for outpatient treatment. This means that 66% of the referrals given were for addiction support services. Of the more than a dozen other types of referrals provided, the most commonly accessed service was for housing, followed at 24%, followed by peer support services at 21%, and the outpatient access to treatment was at 19%. We're also pleased to share more information about the demographics of the people we are serving. It's worth noting that law enforcement partners make referrals, and they may have more insights into the demographics of who is being referred. But here are some of the demographics worth mentioning. Nearly 60% of participants referred to deflection were between the ages of 26 and 40. 57% of those referred to deflection identified as male. 54% of people referred to deflection identified as white. 23% declined to answer that question, and 10% of those referred identified as Black or African American. Nearly 80% of participants listed English as their first language, 18% declined to answer, and 2% identified as Spanish speaking. When asked about drug use, 36% declined to answer the question. But 26% said they used methamphetamine, followed by 25% who said they used fentanyl. A large percentage, 62% of participants reported having pre-existing medical conditions, most of which were dental health conditions at 26%, followed by physical health conditions at 14%, and then mental health conditions at 12%. An overwhelming majority, 80% of participants, said that they had recently visited an emergency department. Almost 45% of participants indicated that they were living unsheltered, and 75%, sheltered or unsheltered, were experiencing homelessness. Nearly 40% of participants said that they needed food assistance. As mentioned, we've learned a lot from implementing this new program. The first quarter presented unique challenges and opportunities. The program was launched quickly and started with a field-based approach before the Pathway Center could open. Programmatic shifts were common in the early weeks of operations, including a pivot from field-based to a center-based approach. Since September 1, we've been able to offer deflection as an option to every referral we receive from law enforcement. And we have some key takeaways from the past few months. We're adding new deflection referral partners to make the program more accessible and are exploring new options for referrals. The leadership team is also considering a potential expansion of the eligibility criteria, as the bar for being referred to deflection is still rather high. We need more transportation options and are currently piloting other transportation options to the Pathway Center, both in Portland and in East County. And we're also exploring additional transportation options from the Pathway Center, including non-emergency transport available on site and leveraging other county and city transportation resources. We're making program adjustments and hoping by the end of year 1 to incorporate more outreach increase follow-up, and create more pathways to services. In the spring, we'll also be adding 13 sobering beds at the Pathway Center, which will make a difference in who we're able to see. We plan to fine-tune data because we want to gain more insights into why individuals who may be eligible are not offered deflection. We also want to look at downstream involvement with the criminal justice system for those who do receive deflection. The work will involve developing new processes for collecting additional data from partners and determining how to share available data across the deflection system. The deflection leadership team, community providers, and Multnomah County Health Department continue to be engaged in conversations on how to improve the program to ensure positive recovery outcomes and reduce involvement in the criminal justice system for individuals who are deflected. The last thing I want to offer is that we're pleased with the collaboration between county and law enforcement partners. We believe that everyone has come to the table to make sure this program is making a difference. And we also want to thank the numerous service providers who have opened their doors to participants in deflection. Whether it's securing shelter, housing, food access, or other basic needs or treatment, together we are surrounding people who are in deflection with services that support every facet of their life so that they are set up for recovery success. And I'm gonna pass to, Tony Vesna.
No, this one is going to go to Commander.
Commander, I'm so sorry, Commander Hughes.
Here, Heather, give me that top sheet.
Oh, yes.
Move this right over here.
All right, good afternoon, everybody. My name is Brian Hughes, and I am the commander of the Portland Police Bureau's Central Precinct. I want to start by thanking all the partners that have joined me here today in the 4002 leadership team. This has truly been a collaborative effort, and it really feels that way. We meet monthly to discuss progress and make any changes, and it's really been a collaborative effort. Thank you for the opportunity to speak about the Portland Police Bureau's role in deflection and our broader commitment to public safety and community well-being. We recognize that many of the challenges we face, substance use, mental health crisis, and chronic homelessness, cannot be solved through enforcement alone. While law enforcement plays a crucial role in maintaining public safety, we also understand that real, lasting change happens when people get connected to treatment, support, and resources that address the root causes of their struggles. Deflection is an important tool in this effort. When officers encounter individuals in crisis, this program allows us to direct them toward services rather than the criminal justice system. It's about recognizing that not every situation requires an arrest, and that in many cases, treatment and intervention can be more effective in reducing harm and improving lives. This approach not only benefits the individuals involved, but also strengthens our community as a whole by reducing the cycle of crisis and recidivism. That said, we acknowledge that our current use of deflection is not where we want it to be. Like many aspects of our work, staffing challenges have impacted our ability to fully utilize this tool. Our officers are balancing high call volumes and urgent public safety needs, which means that opportunities for proactive engagement, including referrals to deflection, can sometimes be limited. However, we remain committed to improving how we implement this program. We are working to identify solutions, whether through partnerships, additional training, or strategic resource allocation, to ensure that when officers have the opportunity to connect individuals to treatment, they can do so effectively. The bottom line is this: we all want to see people succeed. We want individuals struggling with addiction and mental health issues to get the help they need before they become entangled in the criminal justice system. Deflection provides that pathway. And as we move forward, we will continue working to make it a more accessible and effective tool for both our officers and the community. Thank you. And now I'll pass it to Tony Vesna from 4D Recovery.
Hello, everybody. My name is Tony Vesna. I'm the executive director of 4D. I just want to, first off, I want to thank the county and Bernard and the other service providers who really stepped in despite the criticism from the media throughout this process and really tried to implement what I believe the voters called for, which is a public health treatment approach to addiction, but also understanding that there needs to be a criminal justice intervention as well. And I think House Bill 4002 and deflection is a really good policy that accomplishes that. I'm a person in recovery I was homeless on the streets of Portland. I was a heroin addict for a while, living outside. I went to treatment sometimes voluntarily on my own, but the last time that I went to treatment, it was through a diversion program, which is similar to the principles that we see in Deflection. I was offered an opportunity to go to treatment instead of incarceration. I chose treatment, and I've been sober ever since. I'm coming up on 13 years. So I know firsthand that these programs work. I'm very humbled to have a team of other people in recovery who are out working with law enforcement, engaging people wherever they're at and their motivation to change, to participate in treatment. A lot of people want to go, they want to change, but they are stuck and grasped in the disease of addiction, which is sometimes very hard to break. Some of the important takeaways beyond the numbers you'll see, I actually think that the 25% number everybody's going to throw out is actually really, really good. I was actually a little taken away that many people were participating. It's more than I expected this early on. It's a very new program with a lot of people participating in it. But I think the biggest takeaway for me is what hasn't been captured so much by the media, and it's the implementation of the policy and how it affects two institutions working together collaboratively. One is the public safety institution, one is healthcare treatment. Beyond just the individuals that are being deflected in this program, a lot of other individuals are being helped through coordinated care between us and law enforcement. And a lot of people are getting helped, and the help is more rapid. Additionally, the county stepped in when Deflection was first being implemented and set up relationships between housing providers, shelter providers, which gave us additional expediency in getting people off the streets and into shelter, even if they weren't able to access a bed or detox right away. And so I'm encouraged by these first 3 months, and I'm excited to see what the numbers look like after a year. Thank you. And next, I would like to invite my man Bernard from Turk House. And I would just like to say I went and visited Bernard's operation in Baltimore, and we were very fortunate to have him and his team here, bringing the insight that they have with over 50 years of doing similar stuff in Baltimore. So go ahead.
Thank you, Tony. Once again, good afternoon. My name is Bernard J.B. Foster. Once again, just want to thank the people standing in front of this podium, of course, to the county and then to the chair for the incredible work and commitment. Change is not always easy. And so I thank you for the dedication and the tenacity you've brought to what we are doing now. And so just want to comment a little bit about, of course, the first 3 years of this novel program. I'm happy to be with everyone today and, of course, to reflect on the first 3 months of operations at the Coordinated Care Pathway Center. Together with my team, we are very proud that through these first 3 months, most of the individuals who have been referred to Deflection have engaged in the process. We are even prouder that of these individuals, more than a quarter of them successfully completed Deflection as of November 30th, with more outcomes still being verified by the team. As we have stated from the beginning, substance use disorder is a very complex disease, and every single person's journey is very unique. As specialists treating this disease, we know that if we only used overall success rates to measure our effectiveness, it will always feel like we are fighting a losing battle. Instead, we are focused on the impact we are making on each individual we encounter. To date, 34 individuals have completed Deflection, as others have intimated. That's 34 individuals who took advantage of the opportunity to improve their current situations by accessing one or more of the referrals we've provided them. And whilst, there's the impetus to really hone in on the numbers, as we mentioned these numbers, one of the things that I really want to drive home is that these numbers represent people. These numbers represent people. And so, of course, as the chair has already intimated, we want to be transparent with the work we are doing, but we also want to make sure that the numbers are related to individuals and human beings who are getting much needed service. And so just want to be able to cop on that. Whether they are given a safe shelter, peer support, outpatient treatment, detox, or another service, each of these individuals, each of these people is now one step closer to a more stable and healthier life when previously jail would have been their only option. And our team sees those as 34 huge victories. As for those who did not commit to deflection, we won't give up on them. At Turk House, we believe the door to recovery is always open. And whenever people are ready to ask for help, we are ready to help in every way possible, regardless of their history. We know that for most people, the path to enduring recovery is not a straight line. Our Turk House team is here for the long haul and committed to continuing to build out this program to ensure everyone in this community who desires to recover from the substance use disorder is given many opportunities as they need to be able to do that. Once again, I would be remiss if I did not belabor this point that the reason why this program is where it is now is as a result of course, the county and the other stakeholders who are here with me, making sure that definitely this is a beginning step to really a long process and a long state that we are looking to hopefully be able to solve. And so once again, thank you for the audience being given unto us, and we hope to see you soon. Thank you.
Hi, so now we have a few minutes for questions from reporters. I also want to say that we'll follow up, and if you want to have individual interviews with folks, just flag us, and we'll be able to step aside. Any questions from the Austin de Dios from the Oregonian?
Yeah, just had a quick question. What's being done to track people who maybe don't complete deflection? Are you keeping an eye on them to see if they want to come back or need more help? What's that look like?
So Austin is asking what's being done to track people who decline to complete the deflection and how that's being done. Somebody, Heather or Bernard? Sure.
Thank you for that question, Austin. One of the things that just because a person did not complete the process, it doesn't mean that we stop engaging them. Our peers are working assiduously with these patients to continue to sort of motivate them to be able to access services. One of the things in addictions is the stages of change. And many of the patients, if not all, that we will engage will be at the pre-contemplation stage of change. Usually they are ambivalent and they are reticent to try to engage in any type of treatment whatsoever. But this is where collaboration with your 4Ds and other partners, especially our peer recovery community, it's keeping those patients engaged, and hopefully somewhere down the line they'll be able to engage services. And so just because they did not access or they did not complete this first time around does not mean we just leave them to chance.
Couple questions for Chair and maybe Heather as well on some of the numbers. I mean, at first blush, the public says, okay, we spent millions of dollars setting up this center. Officers are doing their job, bringing in a couple hundred people who are eligible for deflection. But the problem, looking at the numbers, is very few are either filling out the forms, getting a referral, and even fewer, hardly any, are actually going to treatment. So where's the disconnect here?
Yeah, so thank you. So I think what I want to say is, we are in this data is on the first few months of the program, and we know that we are just in the beginning stages here. One of the things that's important, and I think Commander Hughes can talk to this too, is we know that there are thousands of more people out in Multnomah County who could benefit from these services. So while you say, law enforcement is bringing folks in, law enforcement has to balance so many other demands on their time. They have their own staffing shortages they're dealing with. So one of the things that we're looking at is how can we increase the number of people who are actually able to access our services and have that opportunity to engage in this pathway. So that's one conversation that's happening. I think on the flip side, I mean, again, when you look at the steps it takes for someone to go through recovery, having almost 1 in 4 people actually go through the referral, the engagement, and actually following up on their services, that's a really good number. What we want to make sure that we're doing is that we're continuing to learn from some of the barriers that might be in place for people to continue that. So those follow-up calls are very important. And we want to learn to make sure that when people are coming into our environment that we are doing the best things possible to make sure that we're encouraging them to engage and keep on going. So again, we're going to be learning from all of this. This is the beginning stage of the investment that you're talking about. The investment wasn't just for these first 3 months. That investment is this ongoing deflection program that Multnomah County and our law enforcement partners, our judicial system, like our behavioral health providers, we are committed to seeing this through. And then,
But I guess the question is what's missing, is officers are bringing in 200 people. That's a significant number of people that are coming in. I guess the question is they come in, and folks are not engaging at that point, and hardly any are actually going through getting the services. It seems there's no direct connection or follow-up to make sure, other than they come in, they go out, that they're going to get and take advantage of the services that the program is supposed to be trying to connect people to, that there's a missing link there.
yeah, I will, I'm going to let Heather and Bernard probably speak to some of that. I will say that the connections are happening, the follow-up is happening, and it depends on where people are at their stage of recovery or their readiness for recovery. So I'm going to let the experts speak because they see firsthand about what is going on.
I don't think there's a disconnect at all. I think, as Tony said, to his surprise, 25%, 1 out of 4, were able to engage it. And if you understand addiction and the disease model, you would soon come to realize that it's not easy for patients who have been struggling with this disease and are exposed to all the elements. Even the sort of the encouragement for them to access treatment is something that is new to them. And so when they come to environments like the Deflection Center, which is a novel idea, which is new, when you get 25%, that when you take into account the stages of change, and as I mentioned before, 100% of the patient that will ever engage in services will be at the pre-contemplation stage of change. In other words, they are not ready to make any type of change concerning their lives. However, the fact that they've been able to engage entities like ourselves, 4D, will begin to get things going. And so it's not going to be a fast, a quick type of fix. It's going to be a long, arduous task of really getting the patient to understand that what the services they are getting ready to receive in the long run is going to benefit them. And so whereas I think for the media may see 25% and they say, oh, gee whiz, 221 and only 34. We see it as an opportunity. All those 221 patients that we engage, as I mentioned, it hasn't stopped. The engagement hasn't stopped. Behind the scenes, peers are still making sure that whether it's a shelter or a housing situation, they are working assiduously to make sure that that happens. And programs such as 4D, ourselves, and the county health department, we are meeting every time to ensure that we can put other mechanisms and interventions in place to help these patients access those services. And so 25%, whilst it may seem a small number, I think for us in the treatment environment, that is a good number. I think there's more we could do, and I think, as the chair has already mentioned, we are working to be able to do that. And now, Tony,
Yeah.
I don't know if you want to.
Yeah, sure. Yeah. 3 things. One is I just want people to think about quitting sugar or exercising or changing any other sort of behavior that they have and how hard it can be to change behavior and how many attempts it takes. Now imagine being addicted to the most addictive substance on the planet, where every time you try to quit, you get physically ill and stuff like that. So people have a hard time quitting. So if that can just put things into perspective and kind of temper expectations around every time we interact with somebody, they're going to change their whole life. People are complex. It takes time to change. The second thing is that, there's been a focus on the deflection intervention as kind of the end-all be-all, but House Bill 4002 had a sort of an iterative and progressive intervention framework where people who weren't successful in deflection and maybe kept, committing small crimes or having possession, they get caught up and then get probation, diversion, stuff like that. So that's still going to happen. So we're just trying to get to the lowest hanging fruit as quickly as possible. Let treatment workers get the people who want to quit, get them into treatment, give a little relief to our public safety folks. And then the third thing is, you have to remember it's 3 months in. Anyone who's started a business, just a small business, 3 months in is not going to yield your best outcomes. And this is a very complex problem with a lot of different partners that are trying to solve it. So if you could save some of your most critical comments until a year, I think that would be best for everyone.
I have a question for the chair real quick. None of this happens without money. Last week, you asked the state for more money to help with the budget shortfall. The governor said she was not ready to give $1 more to Multnomah County until she gets some clear answers. What do you take from the governor's response?
Yeah, I mean, I think anytime you are asked for a large amount of money, right, you want to understand why it's happening. For us, we found out really what the gap is for our homeless service department and the homeless services programs that we are providing. We had that final number, I think it was like on Valentine's Day. And so we wanted to make sure that we were raising awareness about the state we were in and really what the potential impacts were for our community, who has said time and time again that solving our homeless crisis is the #1 priority. So I'm meeting with the governor tomorrow. We're going to have a conversation about that. But, this is a critical budget time for Multnomah County. It is a critical budget time for the city of Portland. And we have been doing so much work over the years in investing resources and programs and people because we want to make a change. We want to provide opportunities for people. We want to see differences on our streets and in our communities. And so we're committing to that, but we need everybody to engage. I will say, in Multnomah County, we have about 20% of the general population, but we have 40% of people who are experiencing homelessness here in Multnomah County. And I think that is something that I also want to make sure people are aware of when we're talking about how exactly we're funding what we need for Portland and Multnomah County. Thank you.
What does it mean to complete deflection? What's the definition of complete?
Yeah. So right now, based on the definitions that were established by the leadership table, completing deflection means a successful, you have successfully taken part in whatever it was that you were referred to. So some people have been referred to shelter. Some people have been referred to a peer support system. Some people have been referred to outpatient treatment. Some people have been referred to detox, right? There's a variety of things, and those are contained in the report. That means within the 30 days after you were engaged in deflection that you have made that connection, that you have done that, you have checked that box. And it takes a lot of work to do that, right? That's why we have people reaching out and following up. It takes a while to confirm that that has happened, but that's what it means, that somebody has been accountable for what's happening in their life and that they are taking that step, taking that initiative to start on that pathway through stability, through treatment, through connection with a peer.
I want to thank everybody for coming. It is, we're at time. So if you have any further questions, please send them to pressoffice@multco.us. And if anybody wants to grab one of these people, if they're not running out the door, please let us know. But thanks again for coming. We appreciate it.